Today I would like to talk with you about what Dr. Budwig said about how cancer develop. For this purpose, Dr. Budwig gives explanation on the energetic and on the physiological level. Let us today speak about a simple physiological explanation. Dr. Budwig found that blood tests of cancer patients have less phospholipids. For Dr. Budwig, this was the explanation for the fact that pathologists in cancer cells repeatedly found an increased number of chromosomes since the cells begin to divide, but, this is very important, but do not create complete cell division, since there are not enough phospholipids. At Dr. Budwig's time there was no genetics as it is today, and of course she did not know about telomeres. Telomeres are the ends of the chromosomes, by the way. But today we know that genes such as the p53, for example, play an important role in cancer, and that cells can only finally die if these telomeres are short enough. This is a very important point. However, telomeres can only be shortened by complete cell division, and it can also be explained that tumors can grow rapidly, really rapidly, without the mitotic rate, the cell division rate of cancer cells being accelerated, but only by the fact that old cells cannot die. This, by the way, do not understand many people, and doctors still quite often are claiming that cancer cells are having a high cell division. But if you then ask pathologists whether this is true, in most cases they do not confirm. Based on the knowledge on the lack of phospholipids and the resulting lower oxygen transport, and the negative influence on our hemoglobin in the body, Dr. Budwig found out that when she administered the right lipoproteins to patients, the blood values significantly changed and improved. For this purpose, she tested many different lipoproteins mixtures, and finally found that a combination of, we all know it now, flaxseed oil, milk and quark or cottage cheese achieved the best results. Flaxseed oil is exceptional in that the high content of linolenic acids with 3 double bonds and 2 electron clouds. This is extremely high reactive, quite more reactive than any other oil on our planet, and can therefore deliver much better energy than other oils. Quark is a living food and amongst other things a great supplier of sulfur containing amino acids such as cysteine or methionine, and also important, consumes little digestive energy in combination with milk. Milk which not only balances the amino acid profile of flaxseed but also stabilizes the lipoprotein, which is also an important thing. By using this lipoprotein, Dr. Budwig succeeded in doing something that the Nobel Prize winner Dr. Otto Warburg had failed many years before, namely to prove that improved oxygen transport, even in cancer cells, is quite possible. With today's possibilities of the internet or the position of women in our society, this would surely have led to a Nobel Prize, and the oil protein diet would have developed into something very big. However, all this took place in the 50s. Therefore, let's have a look to the 3 main reasons why the oil protein diet never, unfortunately never, became an important cancer therapy as it should have been. First,